Hi, everybody. Welcome back. For those of you just joining, I'm Natalie Pagler, the Chief Medical Information Officer at Stanford Children's Health. And I'm excited to introduce this next panel on digital health and adolescent privacy. As we heard about several times in the last panel, everything gets a little bit more challenging when you talk about adolescents. Adolescents are at a very important stage of their life where they are transitioning from young children to capable, enabled adults who are supposed to be taking charge of their own health care. But that's a very complex transition, and they need their parents' guidance, but they also need the right amount of privacy and independence at the right times. I've had the privilege of working with amazing clinicians, pediatricians, adolescent physicians, and clinical informaticists across the country and locally here at Stanford Children's to try to tackle some of these issues. And today you're going to hear in detail some of the special considerations and the ways that we are addressing these issues to enable engagement and empowerment of our teens in healthcare. So with that, I'm going to pass it on to our first speaker, Emily Weber, to introduce herself and give a short presentation.
Thank you, Natalie. I'm really excited to be here and sharing some of what Natalie introduced so eloquently. I think I echo her thoughts that we could not ask for better experts and expertise for this important area. So I'm going to share a little bit about the adolescent confidentiality here in the US, a mighty topic. I'm currently serving as the CMIO at Riley Children's Health and at IU Health. And I'm also currently serving as the AAP's chair on the Council on Clinical IT. So I'm bringing sort of the perspective, although I live here in Indianapolis, Indiana, definitely able to reflect some of the commonalities that all of us are facing with most specifically recent developments in health IT law. And so if we go to the next slide, I'm going to touch on what is probably a familiar topic to many of us, the 21st Century Cures Final Rule. If you haven't heard, this has been front and center. If it were not for global pandemics, I think this would have been probably the biggest health IT story ever. This rule has been in development for several years, and the final rule, which was approved last year, supports seamless and secure access, exchange, and use of electronic health information. So that might sound kind of dry on the surface, but it's incredibly powerful because it is mandating the sharing of EHI. It talks about our common data set, the USCDI. It is deliberately designed to prevent blocking. And then there is a presumption of sharing unless exceptions are met. So if we go to the next slide, what that means for adolescents is that we have these two truths existing together. As Natalie said, we have adolescent standards of care, their autonomy, their privacy. Those are all something that any of us as clinicians know and have to bring into our practice, but we all practice in different states, and somehow that kind of common universal care and autonomy we want to give, it seems like there's expectations that it somehow changes at the state line, which we know isn't true. We also know that clinical data is throughout the EHR, and any element of it could be construed as needing to be private to that adolescent versus who might be also sharing their record. And since the 21st Century Final Rule mandates that sharing, we have to hold both of those ideas together and come up with solutions. So from the AAP's perspective, on the next slide, we can see that the AAP, partnered with other professional societies and came up with a statement that was endorsed and publicized in this year. With some of these selections, you can see recommendations that are bulleted out. We should be thinking about separate and different portal access. We should be advocating for confidential note types or the ability to designate them as such. And we should really be proactive about how we educate our teens and their families about how this transition into adulthood and autonomy is reflected in their health data. And then, just for fun, we should also make sure that our clinical staff understand this and practice it in a consistent and equitable way. So that sounds easy, right? That's 4 bullet points, very, very impactful. And kind of where it's landed us is on the next slide. is some trends that we're seeing from across the country is that people have who are practicing and children getting their care at children's health systems and then throughout healthcare have been cared for in a couple different approaches here very early on. The date for cures was April 5th of this year, so very fresh. But the first kind of things that we're seeing are that there are those with highly granular filtering. So some health systems very much able to identify those elements that are private. But that could produce some reduction and some incompleteness in their records. Excuse me. There's also ongoing privacy challenges from those state laws and HIPAA, as I mentioned. A lot of people are in a situation where they have kind of some safe zones in their EHR where they can put content that meets the cures exceptions, which are those conditions which it's okay to have some guardrails around how you share that information. And really, I think what's emerged is that adolescents and their privacy needs are the spirit tip. They're the use case that's guiding our thoughts around this, because there are lots of things within medical records that, given time and space, need certain levels of confidentiality. And we're not necessarily to a point where those technologies reflect the art of medicine and how we share information in that context. There's also been a lot of focus on the non-technology solutions to master adolescent privacy, and more people having to talk about what it means to have your health data shared. That's not necessarily something every group was doing. So I'm glad to share these kind of trends and ideas that we're seeing emerge through my role at the AEP, and then echo Natalie's sentiments that I think pediatricians and anyone who's caring for adolescents have had this heightened. On a call last night with a group of doctors, one of them said, I think I cared about adolescent privacy before it was cool, before it was the spotlight that Cures has provided. But I really hope, and the rest of the panelists will reveal some of the opportunities that attention's been able to allow us. So I'll look forward to questions later on in the panel. Thank you.
Thanks so much, Emily. You have been so instrumental in helping us think through these issues as pediatricians across the nation, and a really nice job introducing the concept. Next, I want to pass it over to Rachel Goldstein, who is one of our adolescent informaticists here at Stanford Children's, who's been helping us come up with some unique approaches to these challenges locally.
Alrighty. Well, thank you for having me, everybody. I just wanted to start off by saying that this is definitely a team effort. We're lucky at Stanford Children's to have more than one adolescent clinical informaticist, which is amazing. And then working with the portals team, and Natalie has been a pleasure in trying to tackle some of these things. So I will be talking specifically about our approach to the patient portal, specifically with respect to teens, and then talk a little bit about how that has enabled us to scale up our telehealth services as well. Next slide. So I wanted to just start by talking about some of the guiding principles that we used to consider when we were coming up with our portal, developing the portal. And really the first, I think, is the most important, and that is really we wanted to share as much information with teens and their families as possible, and that parents and guardians should have access to their non-sensitive information. Teens, ideally with their consent of their parents, should have access to this information as well. And then teens should also have access to the sensitive information that they're legally entitled to. And finally, especially if we just talked about the 21st Century Cures Act, if the functionality has not yet caught up to the point where we can segregate out the confidential or sensitive information and non-sensitive information, then we really should not be sharing it through the portal. And so that's kind of what we took into account when coming up with our levels of access. So here you can see we have for the teen years, so again, defined 12 to 17, in the center of the chart, two account types. One is basic and the other is plus for teens. And then we additionally have a parent or guardian, and that's our proxy account. On the left-hand side, you can see some of the functionality I pulled out that's essentially most clinically meaningful. And so for the teen basic account, they're able to securely message providers and view upcoming appointments. And really, this is limited intentionally. It was meant to sort of mirror how teens are able to access the confidential care that they're entitled to legally. So kind of 21st century calling clinic, we felt like secure messaging mirrored that. And they're able to do this without parental consent. If, though, parents do give parental consent, which is always encouraged, then the teen gets a plus account or enhanced account. And so they have the same functionality as the basic account, but in addition, they're able to now, at this point in time, view non-sensitive labs and radiology results. And we are actively working on trying to get our notes to a point where we can share that information. You can see the parent and guardian or proxy view is pretty similar to the Teen Plus, and that was also really intentional. My colleagues and I, a couple of years ago, did a study of adolescent medicine providers around the country, asked them about their portal setup and for teens, and it was really all over the place. You know, some places, some institutions had teen-only access, some had proxy-only access, sort of everything in between. And we really wanted there to be parity between our two portal types so that there wouldn't be a risk of coercion for a parent to sort of inappropriately use their teen's account because the teen had all the information and the parent had none. And then I just wanted to highlight that we also do have a diminished capacity workflow for teens with severe intellectual disability, and that is attested to by a physician. When that is triggered, that process, then the parent or proxy is able to get full access to that teen's chart. And it's really thought in that instance, you know, that teen would not be able to ever consent for that confidential care that they're otherwise legally entitled to. And so we're able to revert that access back to the parent. Go to the next slide. So we got really excited after we developed these portal types and, you know, had a big push to sign teens up for My Chart, and then started getting some messages that were supposedly from teens, but in the message itself, it would be, you know, my child is out of their asthma medication, signed parent. So clearly not coming from a teen. And so this triggered work on behalf of many, many fantastic people, analysts and others, to look at about 1,800 charts. And of those, about 2/3 who were thought to be teen were actually the parent. And this was done using all the sort of techniques you can see on the left-hand side. So there was some natural language processing, looking at the portal message I kind of just described, even looking at email addresses compared to parent name. So if email address is janesmith@yahoo.com and mom's name is Jane Smith, and it's probably not a teen account. And so again, a huge amount of effort over the last year plus to clean these accounts up. And so if we go to the next slide, that's definitely one of the big achievements that we have been able to do, is to get our Teen My Charts to this current state where parents truly have the right access, teens have their own correct access. And then we have developed an auditing process moving forward so that as teen accounts are created, we know that they're sort of the correct information is there. This is really important, kind of going back to one of the guiding principles we have of teens being able to get their own sensitive information. And so if we're not actually sure that the teen account is the teen account, then there's no way that we could share that information. So that's, again, one of the main drivers of that project. In addition, just having the differential levels of access has allowed us to share more information by a huge amount of work, again, by others, to filter out lab results, for instance, that are sensitive. We've been able to share all of that for our patients and families, which has been really, really helpful. I mentioned the diminished capacity workflow as well. Again, especially being a tertiary care hospital, you know, we have a lot of patients who do have that severe intellectual disability. And so having a way for those parents to remain fully engaged and responsible for their teens' care was essential. And then to speak to the telehealth piece, kind of stepping back to that functionality table for a second, you know, appointments up until a few years ago were not even visible in our portal. And that was because we had these confidential appointment types like the sexual reproductive health visits, which in California are known as FPACT visits, psychiatry visits, OB visits. Those were all sort of mixed in. And so we actually were able to figure out a way to take those out, kind of, again, Emily speaking to the granularity part of the functionality that's so important. So by doing that, we were able to turn on appointments for everyone. And really, this set us up to actually scale up our telehealth pretty quickly, because it's kind of hard to get a Zoom link, for instance, or a telehealth link for a visit if you can't actually even see that visit is coming. And so that was really essential in our clinic, specifically even during COVID. We were able to maintain numbers that were essentially 98+% of pre-COVID, just based on this ability to scale up. So again, happy to take questions later, and thank you again for having me.
Thanks so much, Rachel. It's been amazing work by you and the entire team to try to figure out how best to serve our teens. And I think you highlight how challenging it is. I will say we can do a lot locally, and we have with our teams done a lot locally to configure our systems. But equally important is partnering with our vendor partners and helping to share our insight and needs, and then them coming to the table with their innovation to develop the tools in a way that we need them. So for our final talk, I'm going to pass it over to Janine Furch from our Stanford Biodesign program to look at kind of the other end of the spectrum and how a startup might approach these issues. So Janine.
Great, thank you, Natalie. I'm so thrilled to be here. And as some of you may know, I'm a neonatologist at Stanford Children's, so I appreciate the irony that I'm talking about adolescents and adolescent health today. But I'm here to discuss how health tech companies can use digital health information and products to serve adolescent populations in a really intentional way. And specifically, I'm here to talk about Emmy. It's a company that I started with my co-founder, Amanda French, in 2017, following the Stanford Biodesign Innovation Fellowship. And as is inherent with all of this work, of course, I have conflict of interest here. I'm a co-founder and do have an equity stake, just to put that on the map. And so what we did was we created a women's health company that really focuses our first product on birth control pill management. The majority of women, up to 82%, take birth control pills at some point in their life to prevent pregnancy. But the real problem is that there is still a huge amount of lack of adherence. So 80% of women miss at least one pill a month. And even just that one missed pill a month leads to over 1 million unplanned pregnancies in the US alone each year. And so we thought this was just a crazy number. This pill is supposed to does work well, but this lack of adherence really was a problem that we could solve through a hardware-software combination solution. So this is now commercially available as of August. So I'll talk through the app first, both on Apple and Android. And the Apple really goes through pill management. So it reminds the individual when they've forgotten to take their pill. It follows up with relevant reminders and text or notifications. And then it provides really important health information when you need to take backup contraception as well. We just this last week launched our telemedicine and pill delivery platforms. So that's something someone can opt into, as well as symptom tracking, which a lot of similar applications do. And this is free on both platforms, so really accessible for adolescents and all women. Next, we have our hardware. And so this is just an example of the hardware that combines with the app, or you can use the app alone. And we were really intentional about using this hardware and designing it in a way that was really appropriate for adolescents. So, for example, all women, but adolescents especially, want to be discreet and have their birth control be portable. Currently, it comes in this very flimsy container when it comes from the pharmacy, and the pills stick out. It's really identifiable as birth control in a blister pack, and that just really needed to change. And we needed a rapid modernization of that. So we did that, and this connects with the app really nicely. We did very intentionally from the beginning a lot of focus groups, interviews, surveys with adolescents to figure out what form factor would really fit into their lives really well. And so we wanted a beautiful and elegant design, which I think we've achieved. So next slide. And then really around these specific adolescent design considerations. So the brand, you can see throughout those slides, it was really designed with adolescents in mind, but to be appropriate for all women as well. We kind of tried to design around the laws around adolescents to really make it accessible to them and not have them be forgotten. Because it's easy to make a company for women above the age of 18, but it's a lot more challenging to make it accessible for adolescents as well. And we used behavioral modification strategies in our apps that are really relevant for adolescents. And the voice that we have, the brand voice, is really supposed to talk to you like a trusted older sister and give you very relevant and factual information. And as a pediatrician, that's extremely important to me that people have the right information. So we do that through our blogs and also personalized feedback on the app as well. And then privacy from the very beginning was an important tenet. And I don't pretend to be an expert in this area, but we knew it was important to collect minimal information. So we only collect a phone number to be able to provide text and relevant reminders, and then any name they choose to give us. So it doesn't have to be their actual name, but really don't collect much other information. It's HIPAA compliant. And then one of our core tenets, which a lot of other apps out there and most of the tracking apps do sell or share personal information, but it is a core tenet that we will never do that for a lot of reasons. We won't share it with partners, we won't share it with parents, and we won't share it with other companies or sell that information. So I think that's really important, especially for adolescents. And then in terms of accessibility, the app is free, so that part, anyone can have access to that. And it's really discreet on an adolescent's phone that you really wouldn't know that that was necessarily for birth control unless you dove deeper. And then in the future, shortly, we hope to be accepting insurance on our telemedicine platform for adolescents to have access to oral contraceptive pills from around the country. So thanks so much, and look forward to answering any questions.
Great. Thanks so much, Janine. And I think it's a remarkable product, and just really love hearing your approach at trying to, as you said, kind of get around some of the regulations or some of the privacy risks by minimizing how much of that health data is included or transmitted or stored, which I think is, a great approach in this case. Unfortunately, there are many other cases where we do need to exchange that health data, and that will help enhance some of our digital health tools. So for the first question, I'll go back to Emily. You've been an active leader and strong advocate in the AAP for a long time. Can you speak to some of the most important advocacy areas to help enable adolescent engagement in digital health tools?
Yeah, I'm glad to. I'll also say I'm inspired listening to my fellow panelists and taking ferocious notes. So I'm really pleased to hear kind of how we're thinking differently about some of this. I think from the AAP's perspective and some of the things that, as a pediatrician, as physicians and those of us for our patients to advocate, I think one thing that's become really clear is that there's strength in numbers, we're stronger together. So when we are demonstrating and saying why these things matter, I think leaning into Dr. Goldstein, her peers in adolescent medicine, and demonstrating that things like trust and compliance and access to care are limited by these designs that we are trying to fit adolescent care into. And so saying that and showing the impact to our patients with that clinical voice has been really important, because I think people think of them in silos, right? They're like, oh, that's a technical tool, and then here's the care. And I'm like, nope, we've really got to paint a picture for people about how limits to the data limits the care and drives those outcomes. And I think all of the panelists can probably say how that storytelling and making it very real life examples is very compelling. So I think that's one area that advocating for kind of consistency in the laws that drive the tools we build has been very important. I think earlier in the conference, someone had noted that we get left out, our adolescents get left out unless we start advocating for that. So thanks for that chance to comment on that. It's a small plug for the AAP. We love strength in numbers. Come join us and learn how to help drive that change in your state. So that was not planned. I hope that's okay that it's an advocacy group. So we got to stick together to get the job done, I think.
Absolutely. And we've had great partnership, throughout the AAP and with many of our adolescent societies. Rachel, on that note, do you want to talk about some of the other advocacy work that you have been involved with, and maybe talk a little bit about how we're kind of sharing, how we're evaluating our work and trying to share that to help with some of that advocacy?
Yeah. So definitely Emily kind of highlighted some of those position papers that we have developed. So the Society of Adolescent Health and Medicine, along with the National Adolescent and Pediatric Gynecology, I was trying to remember that acronym. And then more recently endorsed by the AAP. So really, totally echoing, we need to have all the voices together. I think we've also been trying to underscore that this is not a peds thing, that adults who have proxies and family members who are on their portal accounts may not actually want every single thing shared with everyone. And I think that helps because peds, of all medicine is a smallish bucket. And so, I think we're trying to be mindful of that while highlighting that some of these things really do impact everyone else. Sorry, dogs. And then in terms of the things that we're working on and trying to, assess, we're trying to, as I talked about, kind of share notes more broadly. And I think, one of the things that we've always highlighted is that, we are never going to get to perfection, to 0% of confidential stuff getting out there. I think we are recognizing that, most people don't have any confidential things that we need to protect. And so we're trying to kind of strike that balance. But we are looking, to the tech side to see, okay, can we figure out some machine learning that can understand what is in our notes, such that in real time one day, as a provider is kind of typing in a progress note and putting in something about STD testing, it kind of flags them to say, yeah, you might not want to put that in there. Like that's sort of a dream state. But I think too, we have to recognize that teens are a vulnerable population and that they're not going to be first, on the phone to patient experience to say, hey, my parents found out about my, herpes medication. And I think that's a big deal. And so we have to essentially be the voice for them, and kind of being that annoying, like pokey person in the room when everyone kind of wants to turn everything on and open the gates. So yeah.
Absolutely. Yeah. I think we're so lucky to have so many powerful advocates on their behalf, but there's a lot of work to be done. And to your point about this not only being a pediatric issue, I think that's incredibly important. There is a large group right now called PP2PI, which is protecting privacy to promote interoperability. And they are looking at several use cases for how do we technically segregate that data. And adolescent health is a major use case, but it's the same as, same on the other end of the spectrum when you have an elderly adult who has their child seeing their records and doesn't want every detail divulged. So I think it's really important to recognize that while we are focused on the adolescent population, these lessons kind of stretch across the care continuum. I also think it's important what you kind of highlighted is, thinking about what actually needs to be confidential. What data do you have to even touch on? And so back to Janine, who I think has come up with a really unique approach to solve a major problem while minimizing a lot of the adolescent privacy risks. Janine, can you, what advice would you give to clinicians and entrepreneurs who are looking to develop digital health tools or engagement platforms for teens? Kind of talk about your approach and how you came up with this solution.
Yeah, I think it really helped to be a pediatrician. So, and to be that advocate and to be that voice, because like I briefly mentioned, it's a lot easier. It's never easy to start a company and design a device for adults, but it's a lot easier. There's a lot less regulation. You don't have to design it for adolescents. It's not your population that's going to make you or make the business successful or get you on the map or that investors care about. It just isn't. So unless you're really intentional about it and really realize that for unplanned pregnancies for teens are probably the most significant population and would have the most significant impact in their life. From the very beginning, we were able to do that. And we knew that was part of our core tenet. So I would encourage them in the design process to start to think about how can you access these populations? How can you be very intentional about your design upfront? Because we could have collected a lot of information like a lot of the other apps do, but intentionally did not for that reason as well. And we could have been pretty obvious in our name or in the design of the application or the hardware or any of those things to make it stand out a lot more and to, but we really thought about the use case of someone who their parents don't know that they're on birth control and they, might go through their phone and they might see this app, but what would make them click on that app over anything else? So to really be intentional from the beginning, I think is really important. It sounds simple, but it's much harder to get people to actually do that and to stay in that process and to think at that space. So.
Awesome. Great advice. And I think you really have demonstrated how that intentionality can lead to a product that serves adult women too, but also has a dramatic impact on adolescent health.
Yeah,
So
thank you.
So I think we are at time already. Fascinating conversation as always. Thank you to all my wonderful panelists for participating.